All right, so another pass or fail type of test. Very simple, very easy. If you have a mirror, if you have a buddy, have them look at you while you're doing it. I'm gonna point out some of the key things that I want you to kind of have. Number one is have a pillow or something under your neck or your head to kind of keep yourself off this really jacked up extension in your neck. So you got your pillow there supporting your head. You got your hips down. You got your feet or your legs at 90 degrees. What we're going to talk about right now is proper bracing. Okay, bracing in a pass or fail sense. Bracing is one of the most important things you can do in any movement. Brushing your teeth, washing the dishes, picking up wood, laundry, whatever you're doing, bracing is fundamental. If you're not doing it right, if you're failing these tests, you will have back pain constantly. Okay, so what we're looking at here is first we're going to get you to posterior tilt your pelvis. Okay, so in the first one you kind of saw yourself taking yourself to anterior pelvic tilt and posterior. So go ahead and go to anterior pelvic tilt. So she arches her back, big gap right here. Now go to posterior pelvic tilt. That's going to flatten this out. The hip's going to come back in here. She's going to lock this in. Okay, so now on top of that, she's drawing her ribs down. You don't want to posterior pelvic tilt, have your ribs flaring up. So when you do that, posterior pelvic tilt your hip, brace your stomach here, and at the same time draw your ribs down to make a flat brace here. And this gap here should be pretty minimal. So the pass or fail part is what you're going to do is once you're bracing, take your fingers and dig them into your stomach right here. Brace hard, dig into your stomach, and then cough. Coughing, okay, what that does is it forces tension into that area. And if your fingers come up, okay, if you're bracing and your fingers move, that means you're not bracing properly. You're not bracing good enough. If you can do this and you cough and you put that force into there and your fingers don't go anywhere, your bracing is spot on. You pass. Again, this is pass or fail. If you fail at any point in this, this is what you have to work on. Okay. So again, posterior pelvic tilt the hip, bringing the ribs down, bracing this right here nice and tight. Dig your fingers in, cough. If your fingers come up, you fail. If your fingers stay in place, your abs are still braced, a nice rock hard position, you pass.